Good afternoon, everyone. I would like to thank organizers of GSAC WebCon 2020 for giving me opportunity to present a lecture on trigeminal nerve radio frequency ablations, how I do it. In this lecture, I would like to cover a topic on a brief of anatomy, symptoms of trigeminal neuralgia, radio frequency procedures, uh, and complications. First of all, we see the functional anatomy. Trigeminal nerve originated from the medulla oblongata of brainstem. Motor nucleus and sensory nucleus combine to form a trigeminal nerve, which passes through the base of the skull to reach to Meckel's cave and form a Gassarian ganglion. From Gassarian ganglion, trigeminal nerve is divided into a three branch. First is ophthalmic, second is maxillary, and third is a mandibular nerve. Uh, uh, Distributions of pain of trigeminal neuralgia is in ophthalmic, maxillary, and mandibular divisions are three different divisions. Ophthalmic area, we have a pain over the forehead, some part of the front of the skull, and middle of the nose. In maxillary branch, the pain is below the eye and upper lip, and in mandibular branch, the pain distribution is along the lower lip and lower jaw. The classical neuralgia having a following symptoms. It has a very episodic, sharp shooting, stabbing, lancinating, electric shock like pain. It's a brief episodes of pain from second to minutes. It is unilateral. If it is bilateral, then we have to uh, rule out the multiple sclerosis like systemic pathology. Pain occurs along the one or more divisions of trigeminal nerve. Most common divisions are mandibular and maxillary divisions commonly occur together. So it is a spontaneous or evoked pain, mostly evoked by the some air or sunlight or anything. Even sound can evoke the pain. In severe cases, multiple attacks of pain occur over a short period of time, and patient becomes asymptomatic between the attacks. Uh, Normal facial sensation, patient does not have any numbness in this type of trigeminal neuralgia. uh, I would like to skip the part of pathophysiology and diagnosis, as my main topic is intervention treatment. Many interventions available, but in pain management we are regularly doing percutaneous radiofrequency ablations of Gassarian ganglion. Preparation of patients for procedure is must require. So preoperative blood test, physician fitness is required, consent for procedures. Mostly procedures done under local anesthesia, but many times if patient is non-cooperative or patient is fussy, then we have to give some sedations or short general anesthesia. Uh, Equipment of radio frequency is most important thing. It is costly machines are Costman is very commonly available. Many other companies are available also. Cannula for radio frequency is very important. It is an insulated needle. It has a 5 millimeter active tip. It's a cow tip, and 10 centimeter long needle is most commonly used for this type of radio frequency treatment. Position of patient in operation theater is a supine. Uh, Head is kept in a head ring. Put a pillow below the chest to create extensions of the head. Positions of IITV is also required to find out the foramen oval. The most important part of this procedure is to find out the foramen oval, as nerve is passing from the foramen oval. Uh, we have to do some inclinations of caudal inclination and ipsilateral lateral inclination of 20 to 30 degree to find out the foramen. Uh, Entry point of skin is marked with some points. The most common point is 3 centimeter lateral to the angle of the mouth. Here you can see in this image the needle is just lateral to the angle of the mouth, and we have to keep our needle upward towards the direction of the pupil. Foramen oval is find out in a IITV. Its length of oval is 7.5 millimeter and width is 3.7 millimeter. Commonly seen mandibular nerve is passing through the foramen. This is the skull image in which you can see that the needle is passing through foramen oval and we have to keep our needle inside the foramen oval. Positions of the needle is most important inside the foramen. For different divisions, we have to keep needle either lateral or medial side. For mandibular divisions of RF, we have to keep needle on lateral side of the foramen. And for maxillary and ophthalmic, we have to keep it on a medial side. Maxillary, we have to keep medial and ventral. For ophthalmic, we have to keep medial and dorsal. Uh, this is the image of IITV. You can see this is arrow showing this is oval shape foramen oval, and in this lateral image you can see this is the needle which is passing through the foramen oval in image. Many more images I can show you. This is image I doesn't mark, but you can see here this is the foramen oval, and it's very difficult to find out uh, under the IITV, but commonly we are doing multiple procedures, then we learn how to find out the foramen. This is a lateral image where my needle is passing through the foramen oval and reach up to the Gassarian ganglion. Another also image, you can see needle quite laterally in the foramen and lateral image. This is a brief video showing stimulations. After needle placement, we have to do the sensory and motor stimulation. In sensory stimulation, we have to ask the patient whether he or she feel the pain in which area, either mandibular or maxillary or ophthalmic. And then patient give us an answer whether it is confirmed that area of distribution should be along the pain. In this video, you can see the motor stimulation. This is the machine. My electrode is passing through the needle in the face. Uh, Here you can see some masseter muscles contractions. So this is a motor stimulations. Another important thing is what is the temperature we have to keep for ablations of the nerve and how much the duration of seconds we give. Multiple options is available, multiple recommendation is available, but I usually keep it like uh, three lesion I generate of 60 seconds each. First is 65 degree, second is 70 degree, and third is 75 degree Celsius. If we keep lower temperature, then recurrence of pain is high, and if we keep high temperature, some complications are numbness over the face is also high. So this medium type of temperature giving good results with good durations of the effect. If we don't find foramen oval under IITV guidance, then we have to do see this procedure under CT scan guidance. And here you can see that needle is passing through the foramen oval and inside the foramen oval reach up to the Meckel's cave and Gassarian ganglion. After the completion of procedure, patient is shifted to the recovery room. We have to keep under observation for at least 1 hour. Uh, some complications during the procedure and after the procedures are following. Most common complication is bleeding, uh, infections, numbness over the area. If we keep a temperature high, then numbness is very common. But usually this numbness is passing through over a period of 2 to 3 months. Numbness will gone away. Dysesthesia means patient having a more pain before the procedure, uh, much more pain than original pain, and it's very difficult to treat this type of complications. Another complication is common for mandibular nerve division is a masseter muscles weakness, which is also recover over period of 1 to 2 months. Another complication is loss of corneal reflex and keratitis, which is commonly seen in ophthalmic division. So routinely for ophthalmic division, I usually prefer pulse radio frequency, in which temperature we have to fix at 42 degrees Celsius. So the damage of the nerve is not occur. And last in the most common is recurrence of pain. This is I cited a neurosurgery journal article, comparison between surgery and radiofrequency procedures. The results are very much common, and same initial pain relief is 98% for both surgery and radiofrequency. Recurrence rates are also quite comparable. Radiofrequency rhizotomy has a 23% recurrence over a period of 9 hours, and microvascular decompression surgery has a 15% of recurrence over a period of 5 years. So overall, I can say that if patients want to go for a minimal invasive treatment for trigeminal neuralgia, radiofrequency procedure is quite a good procedure to give a pain relief. Thank you very much.